Hi everyone, we're here in Capital News with Dr. Jacob Glanville. Doctor, welcome to our channel.
Thank you very much for having me on.
Doctor, let me explain to our audience that aside from your appearance in the Netflix documentary Pandemic, you have a respected career as a scientist. Jacob Glanville es emprendedor, inventor e inmunoingeniero, cofundador y CEO y presidente de Distributed Bio. El Dr. Glanville y su equipo han desarrollado una investigación notable en el mundo de la biotecnología. Han permitido que Distributed Bio entregue algunos de los principales anticuerpos terapéuticos a más de 50 programas en toda la industria farmacéutica. Es el inventor de la tecnología universal de vacunas Centivax para influenza, VIH y otros patógenos que mutan rápidamente. Es un asesor también en reconocidas universidades como la Universidad de Stanford y la de San Francisco, solo para mencionar algunas. Doctor, thanks for having us. Understanding how busy you are because of the latest announcements you communicated about the possible antibody that neutralizes the COVID-19 that already killed more than 64,000 people all over the world. Would you care and explain to us how you plan on neutralizing this pandemic?
Sure. So what we are developing is an antibody therapeutic. I'll tell you how that works, and then I'll tell you how we created it. So the coronavirus, if you were to zoom in, it's surrounded by a series of spikes, and it uses those spikes to invade your cells and infect you. What we have created are antibodies that go and block those spikes on all sides, so the virus is no longer infectious, and therefore it cannot hurt you. The way we did that is we went back almost 20 years to antibodies that were discovered and researched against the SARS virus during the outbreak of SARS. Those antibodies were very potent, and they neutralized SARS, so they would be a great medicine if SARS ever returned. What my laboratory was able to do was take those, and by applying hundreds of millions of mutations, we're able to adapt them to recognize the new coronavirus, which makes them an effective medicine now to be able to treat the novel virus.
Doctor, is this considered a vaccine?
So it's different than a vaccine. So both vaccines and antibody therapeutics work through antibodies. They're both similar in that you receive a shot, but here's the difference. With a vaccine, you get an injection, and it contains many pieces of the virus. So your immune system then slowly responds to that virus and learns how to create antibodies against that virus. And that process is slow. It takes 6, 7, maybe 8 weeks, and then eventually your body is full of protective antibodies. What I'm producing is a syringe, but instead of being full of pieces of the virus, it just is full of antibodies. So when we inject that into you, it works immediately. Within 20 minutes, your body is protected, so you don't need to wait as much time. There are advantages of a vaccine. A vaccine can last for longer. Your immune memory may last 1, 2, 3, maybe 4 years. Whereas with the antibodies in the syringe, it works immediately, but it may only last 8 to 10 weeks. But the advantage is a huge one, and that is because it works immediately, you can give antibodies to a patient, and you could save their life. Whereas a vaccine you cannot give to a patient because it takes too long to make the antibodies. They will already die or recover by the time it helps. And that's why it is antibodies that have been used to transform the Ebola crisis, where they created a good antibody therapeutic, and suddenly it went from people 50% chance of death if you have Ebola to 94% chance of living. So it was a life-saving therapy. So it is a very powerful technology platform, and it is appropriate for this particular virus, both because it works immediately as an antiviral in patients who need it, and also because we were able to develop a new medicine in 8 weeks, which is remarkably fast to develop a new therapy. And that's the consequence of the power of antibodies and then the remarkable team that I'm fortunate enough to work with.
Doctor, have you already tested on humans?
No, we have not. So what we have is a candidate therapy. So we have an antibody. We know that these are versions of these antibodies were potent at protecting, blocking the virus in a test tube, and also protecting animals against SARS. We've adapted them so that they bind the same way to the cousin virus of coronavirus, but they have not yet been tested in humans. So right now, we are sending our antibodies out to the U.S. military, to a Gates Foundation consortium, and to a laboratory called Sinobiologicals in China. And all three of these groups are going to be testing how vigorously our antibodies block and kill the viruses. We're also performing safety and toxicity analysis using Charles River Laboratory Services, and they're checking to make sure as a drug that this would be safe to administer to people. And then we're also scaling it up, producing very large batches. We haven't started that yet. We're about to scale up, and that takes a few months to go make those. You have to do all of these things before you can do a human study. So right now we are contemplating a human study at the end of summer, and what we're going to do is a phase 1/2 study. So that's one big study. We give the drug to about 600 people who are sick with COVID-19 in the hospital, and when we watch them, and if it's safe and if it's protecting lives, then we can begin releasing hundreds of thousands or millions of doses all over the world.
Dr. Glanville, in the latest interviews you have given, you mentioned that the government must pay for all of this. It is a relief to know that this investigation is not going to be given to private industries. Is this accurate?
So my company never accepted venture capital, so we're not publicly traded. So we are a private company. We're profit driven, but I only have 30 employees. So part of our intention here is to make a medicine that the whole world can use. I grew up in Lake Atitlán in Guatemala, so I grew up in Latin America, and I have a realization of the importance of medicine being accessible and affordable. I would never want to go back to my hometown and tell my friends there, look, I'm sorry, I'm making medicine you will never be able to afford. That's ridiculous. Also, in a global pandemic, you need everyone to take medicine. You need lots of people to have access to it, because the minute we have a medicine, the crisis is over. Right now, we are in this ridiculous position where we have all had to go to our homes, and we've broken down normal society. We're worried for our lives, and we are also damaging our economy. And it's because when you get COVID-19, 90% of people don't get that sick. They might be miserable, they might feel bad, but they're okay. But it's 10% of people go to the hospital that get sick, and that's a lot. And of the people, if you go to the hospital, you're in trouble. 10% of those people could die. And that's the reason we've all had to go to our homes. We've paralyzed the world. The minute we have a medicine, the minute the doctors have something they can give you where it's no longer 10% chance of death, where you feel bad, you feel better, you go home, this whole crisis is over. We can all go back to work. We can start hugging our grandmothers again. And so that's why we've been working furiously to try to make a medicine as quickly as possible. And our strategy is to make it as close to the cost of goods as possible. So antibody therapeutics are more expensive than vaccines, but they don't have to be crazy expensive. When you often hear about antibody therapeutics like rituximab, those they charge $10,000 for a dose. But the cost to create it is like $100 per dose. All the rest of what you're paying for is corporate profits for the company that built it. And the companies say, well, we spent billions on creating this medicine. But they did that because they have 50,000 employees, right? They have a crazy number of people working for them. And so they have to charge a huge amount of money to recuperate their costs of goods. They also had inefficient technology. So it took them many, many, many years to produce a good medicine. Here, I currently have 30 employees. We're going to expand to probably have 60 by the time we're doing clinical trials and approval and handing things out. But we're going to use contract research. We're going to use government grants. And we didn't spend that long to build up these medicines. So, and there are many people that would use this medicine if it works. So basically we can charge a little bit on top of the cost of goods, and we will do just fine. It will work for my business, and we'll be able to distribute it for a radically cheaper price than traditional antibody therapeutics.
Meanwhile, what is the message you give to the Colombian people to contain this pandemic until the antibody gets here? We still see people in the streets, probably because our numbers are not as high as the United States.
Yeah, so it will change. Unfortunately, that's what's happened in every nation, including the United States. For a while, the United States didn't take it seriously, and we're starting to shift over. I would say two things. One is for people who aren't taking it seriously enough, you need to start taking it seriously. This is much more infectious than influenza, and it is much more lethal. No one is safe. It is true that children are largely unaffected. They have less disease. But even young adults in their 20s and 30s can die from this. This is not safe for anyone to take. It's not like chickenpox. So please, for your own health, but also for the health of those around you, your grandparents, your parents, and your friends, those that are immunocompromised, it's important to stay protected. On the other side, I want to take those people take it seriously, there's certain people who are freaking out, and I want them to calm down a little bit. That this will be bad for the economy, but we will make it through this by washing our hands, avoiding unnecessary social contact, cooking a few more meals at home, learning to paint or draw or do something that doesn't involve lots of hanging out. I know we're going to miss dancing, but wait a little bit. And the other thing I would say is that biotechnology has never been better than it is today. We are making new medicines. They are on their way. And the minute we have a medicine, this problem fixes itself, because then it's no longer a crisis and we can all go back to work. So just hold it out. Try to use the time to, write that book you always wanted to write, or read those books, or contact those old friends, and we'll make it through this together.
Thank you, doctor, for the time you have given us. Please say hi to your team from us and give them a big thank you for the incredible job you all have accomplished. We are proud of your Latin origins and we hope to have good news soon.
Lo mismo, gustaría decir que soy muy agradecido de tener esta oportunidad de hablar contigo sobre mis investigaciones y hablar con mis amigos en todas partes del mundo, incluyendo Colombia. Gracias.